Good afternoon. Thanks, Dr. Lata. And it's a privilege for us to work with you and the whole group. I do hope these webinars are collective efforts of doctors and the healthcare workers, including you and your students and teachers across India. We are putting special effort for this because without you, we would be a failure. I thank Martin else who have made this possible. I bring greetings from the ILBS, which is a dedicated liver university. I would like you to put your questions in the chat box because I think this message of mine today, I have nothing to disclose except we have bright faculty and brighter residents. My message today is learn and teach. So I'm learning from you. Post your questions. I'll briefly start with liver and its functions. I know all of you know it, but I'll still try and cover some of it. The largest immune gland of the body, weighing 1.5 kilograms, is located in the right upper quadrant. And the main functions of it are known to you: detoxification, metabolism. But what is probably less known is that it controls your blood sugar and fats. And there are two types of circulations in the body. One is the blood and second is the bile. So bile and intestine is a separate circulatory system. In a way, liver is the boss. The fact that alcohol damages liver and viruses are well known to you. And India contributes 1 in 5 globally due to liver disease. So let us learn. The fat in the liver, if it is extra, it inflames the liver and harms the other organs of the body. Please remember, inflames and harms. So normal liver, which is like a maroon color, it's not come out well, is less than 5% of fat. But if the liver is more than 10% of fat, it enlarges, becomes slightly whiter, and this is because of excessive calories and your genes. And altered gut bacteria change the liver, and the fatty liver changes the bacteria. Remember this. Now, this is a journey of fatty liver. So the extra fat in the liver inflames the liver. How? So this is the liver biopsy. All these white cells that you see here are ballooned fat containing cells. Now, when you have such a cell, the body's white cells, the immunity says, oh, this is not a good cell. Isko to maro, is cells ko khatam karo. And they will come and collect here. All these white cells collect, the blue dots are white cells, and they have killed these cells. So this is called hepatitis, fat-induced hepatitis. Now this has to heal because the normal process after death of a tissue or cells is scarring, fibrosis. This is fibrosis of the liver, and in some to cirrhosis, scarring, and in some to liver cancer. And both these conditions may require a liver transplant. And the death of cells can be read in the blood by an increased SGPT or ALT. And the burden of this liver disease itself, you can see, is about 20,000 million euros in European countries. It's a huge burden. Now, these white fat-containing liver cells do not allow insulin to come in. Where is all the energy metabolism produced in the body? Is in the liver. So the insulin cannot get into these cells. And therefore, pancreas has to produce more and more insulin. This is of time, your pancreas will become exhausted and the person gets diabetes. So fatty liver precedes diabetes by many, many years. Let's take two examples. There is a 55-year-old man whose blood sugar is 95. Now, he has no fat in the liver. These are all cords of liver cells. You remember very well, nucleus is central, well placed. Now, his sugar is 95, but he uses 2 units of insulin because the insulin get into liver cell. Now, there is a second person who has all these fat containing white fatty liver cells. Now, his sugar is on 95, but he utilizes 20 units, average 95. Every day, 10 times more extra insulin is needed by the body. And therefore, this is a state of insulin resistance. If you understand this, rest of my talk is meaningful. So blood sugar alone is not enough. Remember to get serum insulin done in every other person. And diabetes, remember, is a liver disease. Let's see what the liver diseases do. Now, here we used to see hepatitis B as the commonest cause of liver cancer. But in 2022, from this WHO center, we have close to 2,600 patients of liver cancer. And imagine the commonest cause, diabetes. So a person who has diabetes contributes and is susceptible to develop liver cancer. And this is also shown in the global map, liver cancer due to fatty liver disease. So if out of 100 people with liver cancer, more than 35 are due to diabetes, they are shown in maroon. And you can see India has maroon. Means out of 100 liver cancers, more than 35, more than 1/3 are due to diabetes. Now, what else do we need to know? Fatty liver and non-communicable diseases. So I told you, if there is fat in the liver, there is insulin resistance, because of which diabetes, because of which high SGPT or ALT as a marker of hepatitis. But now the next stage, a person comes to a nurse has taken the blood, वो कहता है मैडम मेरा तो कोलेस्ट्रॉल बहुत ज्यादा है, पिछली बार मैंने दवाई शुरू कर दी थी, मेरा ट्राइग्लिसराइड बड़ा ज्यादा है पर अब ठीक है. बट यू आस्क दैट पर्सन कि भाई तुम्हारा कोलेस्ट्रॉल हाई कैसे हुआ, तुम्हारा ट्राइग्लिसराइड हाई कैसे हुआ, कहां से आया वो? This is the reason that once the liver is full of fat, that extra fat, extra triglyceride goes into the blood. So almost every person who has a high cholesterol or triglyceride has high fat in the liver. Please understand, these are not diseases of any other. These are a result of fatty liver. Now this fat circulates in the blood and deposits on the arteries. So the arteries become hard and your person has atherosclerosis, blood pressure, heart disease, kidney disease, bone disease, cancers, stroke, and gallstone. Gallstone is not a disease of gallbladder. It's a disease of fatty liver. So now I've told you that fatty liver is the core to all non-communicable diseases. If you understand this, I will be very happy because you can control it. So the risk increases if the person has high ALT. Suppose somebody's SGPT or ALT is 20, he is healthier. Compared to somebody whose SGPT is 80, this guy has ongoing, continuous inflammation in the body. If somebody has high cholesterol, triglyceride, and high ALT, he is worse. Suppose somebody has diabetes and high ALT, he is worse. All those who have high ALT and metabolic diseases are worse. So remember, you have to look for fat and high ALT to reduce the risk. Now here is something what Manya has published recently 36 studies with almost 7 million adults. A person who has fatty liver compared to those who do not, 29 out of 1000 will have cardiovascular disease related, maybe they may die. And out of 1000, 19 more people will die due to cardiovascular disease. So in a way, you can see that 48 or 50 out of 1000 people may have a poorer outcome. So people with fatty liver disease have a greater chance of developing CVD, and it is the commonest cause of death in fatty liver. Doesn't it worry you? Kidney disease. Those people who have fatty liver have increased risk of CKD, 41% increased risk in just 3 to 5 years. So you have fatty liver and you have CKD. Suppose you have both करेला और नीम चढ़ा, डबल प्रॉब्लम. अगर इसी को आप रोक लोगे तो हो सकता है किडनी डिजीज बच जाए. कैंसर्स. नाउ दिस इज ए मेटा analysis, 1,82,000 individuals who were followed for nearly 6 years. Those who have fatty liver have more esophageal, stomach, pancreas, colon cancer, almost 1.5 to 2 times. And lung, breast, gynae or urogenital system cancers are also increased because it is the inflammation which is reflected by ALT. Now, suppose you have a lady who is 35 and her ALT is high. What will you advise her? भाई तू जल्दी ठीक हो जा, ALT कम कर, नहीं तो क्या होगा? You may develop all these gynae cancers, lung cancers, GI cancers. So this, as a nurse, as a healthcare provider, remember whenever you see somebody who has high ALT or is obese, and you help them. So metabolic syndrome, which we call the core, is fatty liver disease. It can cause high BP, CVD, diabetes, CKD, obesity is associated, high lipids. Also, young girls, polycystic ovary, sleep apnea, snoring, dementia, stroke. Generally, people think that fatty liver is obesity. You are right. All obese will have fatty liver. But the reverse has to be looked into. So let's look at the prevalence of this problem. Now, countries where there is 30 or more % of the people living, population में 30 से ज़्यादा % जहाँ fatty liver है, 1 in 3 are shown in red. Now see in India, red. So we calculated the last 2 weeks ago, on 21st November, India's population is 1.4 billion and fatty liver is expected in 43 crores. And in young people, like all of you, 15 to 24, 23 crores have fatty liver. Isn't it a problem which you should be aware? You can handle, you can prevent these. Now, this is an important slide where I was part of it, that people who have normal weight, overweight nahi, normal weight, even in them, if the population, let's say you take 100 people with normal weight, in them, if 30 or more people have fatty liver, देखने में पतले दुबले हैं, India still has 30 or more % with normal weight and fatty liver. Now let me explain this very important diagram. Visceral fat means fat in the abdomen versus subcutaneous fat. If the visceral fat in abdomen is more than the subcutaneous fat, you have insulin resistance. So you may have an obese person, but his visceral fat is less. And today I saw someone like that. She was a 75-year-old lady and her weight was 80, but she was perfect. She was obese but metabolically healthy. Now there is another person who looks as lean and thin. His body weight is normal or low, less than 23. But his visceral fat is more than subcutaneous fat. He is obese but looks normal. Let me show you this data. Very important. Please learn it as a nursing group. There are two people. Both have BMI of 22. Now here is a person who is healthy. See, this red color is muscle. See, the muscles बहुत अच्छी है. Green is subcutaneous fat and blue is visceral fat in the abdomen. Now compared to the fatty liver person, the visceral fat, the blue is too much, the green is too much. So in this person, lean NASH almost 5 times more subcutaneous or visceral adipose tissue. This, although normal BMI. So this India has 30% of the population is like this. How do you know? Easy, very easy. You say, sir, हमारे पास तो instrument ही नहीं. So you can do what is known as a body composition analysis. Learn and then teach. This person has a BMI of 26. Looks like all right. But percentage body fat is 40%. And the lean mass, which is muscle, is low. Left leg, right leg, everywhere there is no muscle. And in the abdomen, he has 40% more fat. So how much more fat he has? 18 kilogram of fat he has to reduce. And muscle he has to add 7 kg. So this is the way we can find out the extra fat. This is all visceral fat and this is the subcute and overall body fat. So let me summarize this to understand and maybe to take you forward. Liver fat precedes diabetes and heart disease by 15 to 20 years. If you have fatty liver, don't let these develop. And prevent blood pressure, heart disease, CKD, cancers. But कुछ लोगों को तो already diabetes है, heart disease है, BP है. If you remove the fat from the liver, body weight, you can convert it. So you can reduce all the complications of metabolic disease. The biggest public health issue today. Now, how do you diagnose fatty liver? All of you, everyone can diagnose after 5 minutes. How do you know it? So first is self-test. So you learn and teach everybody around you. What is self-test? If your family or yourself has obesity, diabetes. Everyone who is obese has fatty liver. Diabetes, you have fatty liver. Blood pressure, I told you. Heart disease, I told you. So anybody who has these diseases is likely to have fatty liver. And if your weight, height minus 100, your height is 170, उसमें से 100 घटा दो, 70 किलो weight हो. But अगर family history है, then you reduce 105. तो आपका weight 65. आप female हैं, तो भी आपका weight कम होना है. Then self-test, you do now confirmatory test. A simple ultrasound or a fibroscan. And blood test, if your SGPT, ALT is above 30, your lipids are high or your sugar is high, you have fatty liver. So now you are a master. Raise hands that yes, we can diagnose fatty liver. Can you raise hands, those who have diagnosed? Let me see how many can diagnose fatty liver. Please raise hands. Wow. Some have not understood. Should I repeat or you can do it? Many people have not. Can you hear me? All right. So let me repeat this simple thing. Please keep a copy of this on your desk and you can diagnose. This is going to make a difference in the country. So if you have not understood the previous slide, let us make it simpler. Suspect fatty liver in every diabetic, every overweight and obese, and lean or normal weight. If your waist is high, your BP is more, your triglycerides are more, sugar is more, or there is a family history. इसकी तो आपने copy slide की रखनी, because then you can diagnose without going anywhere and you can teach it to everybody. Suspect, test, detect, manage, and reverse. Now, how do you measure waste? I'm telling you. So waste is measured like this, and waist hip ratio should be 0.7. In males, the waist should be less than 90 centimeter and females less than 80. अगर ज्यादा है तो क्या होगा? Fatty liver. Waist to hip ratio ज्यादा होगा, fatty liver. Waist is to be there. Okay. Now, very simple test, fibroscan, which is an ultrasound. And in a fibroscan, this is called controlled attenuation parameter. Means the sound goes, it is attenuated, inhibited by the fat. And the inhibition should show the normal is 220. Anything above 250 is fatty liver. 306 means it is almost 30% to 40% fat in the liver. मतलब liver काटो, 100 ग्राम में से 30 ग्राम फैट है, वो बेकार का लिवर है, वो डोनेट ही नहीं कर सकता लिवर. He cannot be a living donor. फिर फाइब्रोसिस, मेरा लिवर हार्ड तो नहीं हो गया. Normally, the harder, the faster the sound comes. Softer thing, sound takes long time. Now, normal liver 60 milliseconds, but harder liver 40 milliseconds, 3 milliseconds. This is 8.5 stiffness, kilopascal. This indicates stage 2 or more fibrosis. So any person who has a normal liver will have 3 or 4, not more. All right. Now let us come. What is your role? What is the role of the AIMS and all other major institutions? What are the efforts done by India? So we tried to convince the policy makers in 2020, and in 2021, Government of India included fatty liver into the national program. Screening, control of fatty liver is a national program. But we have a lot of work to do. We have to implement this so that screening is done, and in one decade, 2020, 33 or 35, we should reduce it. How? So fatty liver awareness everywhere. Lifestyle changes, you know that, and I think there are very good lectures after me by Dr. Sibi. We also have to see that screening and early detection is taken care of. Timely, affordable, accurate diagnosis. But you can diagnose self-test and some simple blood tests. What are the tests? Ultrasound है, fibroscan है, ALT है, blood sugar है, और आपका कोलेस्ट्रॉल या ट्राइग्लिसराइड आपने डायग्नोज कर लिया. फिर उसको ट्रीटमेंट अफोर्डेबल है and rehabilitation. So this is the basis of your involvement and my requesting you to be part of this. This is the bottom up approach. So in the very, very remote villages, ASHA worker will do the self-test. सारी पॉपुलेशन की विलेज की कहेगी भाई तुम्हारे यहाँ ये है ये नहीं है. फिर जो गड़बड़ वाले लगते हैं, जिनको लगता है फैटी लिवर है, दे विल रेफर. फिर पीएचसी में गए, वहां पे दे विल बी फर्दर आइडेंटिफिकेशन, एंड अनकॉम्प्लिकेटेड फैटी लिवर कैन बी मैनेज्ड. शुगर है, खाना है, वेट रिडक्शन है, ब्लड प्रेशर है, कैन बी मैनेज्ड. मेटाबॉलिक सिंड्रोम जो ज्यादा है, थोड़े हाई रिस्क है, उनको सीएचसी भेजा. There they will have some blood test, FIB4 होगा, I'll show you, and advanced fibrosis are referred to district level. So we have to monitor the numbers कि आपके village में, आपके district में there are 40% people who are like this. In next 10 years, they will be 30%. In your hospital, they are decreased. And major role is of nurses, healthcare workers. For example, We all are part of the national mission on hypertension and diabetes. 75 million people, 75 million are to be controlled in 2 years. Their diabetes and their hypertension has to be controlled. So when you are going for this, why not check obesity, diabetes? All of them have fatty liver, family history. You can start research projects, across India and say nurses ने 1 लाख लोगों को 5 लाख लोगों को screen किया and test and improve. Medications, medical conditions can be checked, metabolic syndrome. So all these people are suspected fatty liver. Screen and educate. And in my request, include fatty liver screening and management. अच्छा, एक आता है, उसके साथ 2 और आते हैं. हिंदुस्तान में तो यही है. मदर को लाए, दोनों बच्चे, भाई बहन, हस्बैंड सब आ गए. You are requested to screen the families. Many of them may also be unsuspecting patients with fatty liver. Try and help them. But why should we do all this? इसका फायदा इतनी मेहनत करने का मैं क्यों करूं? So 3 million Koreans, 2009 to 2013 were part of a study, and they did what is called as a fatty liver index. बड़ा simple है. BMI, waist circumference, I told you measure, serum triglyceride, and a blood test called gamma GT. This makes a fatty liver index. Gamma GT generally goes with heart disease, cardiovascular. Triglyceride goes with hypertension and all other cancers. Now, with this fatty liver index, जिन patients के नहीं था fatty liver, but they developed fatty liver, and this index was above 60. Diabetes was twice, दुगनी हो गई, or death was 46% more. But that is not so much important. What is important is in patients who had fatty liver, but it regressed, उनका liver से fat निकल गई, death was reduced by 17%. Can't we all join hands so that less Indians die, less family members die? None of you has illness. So this is my last slide, and this was designed by Manya. Control fatty liver to reduce the non-communicable disease burden. This is my message. This is a vision 2035. And nurses, brothers, you have to play a very, very vital role. What is the role? I have put N. Population level interventions, screening and early detection. Wherever you are, in 1 month, if you see 100 patients, you can change 100 and 200 relatives. एक नर्स ने 300 को चेंज किया. India has 1 million nurses. You will change 30 million people in a year. Risk stratify. भाई तुम रेड लाइन वाले हो तो लाल बत्ती वाले, you go to the red line. तुम ग्रीन लाइन वाले हो, ग्रीन में रहना, बीमार मत पड़ना. येलो वाले को ग्रीन में लाना है, रेड वाले को येलो और ग्रीन में लाना. So this is all the job of you people. You are smarter, better placed, better communicator. Then awareness generation. Wherever you talk, you go for a dinner party. आज उसके यहाँ शादी है, आज नर्सिस की पार्टी है, आज फेयरवेल है. भाई मुझे तो ठीक रहना है, मेरा फैटी लिवर नहीं कराना है, और है तो ठीक करना है. So your food, your work, your running, your job, not using stairs, not using lift, using stairs, all that is every single activity you will awareness generation. Then public health interventions, individual and public health. So I request you to develop protocols, nursing colleges to develop strategies, how nurses can change this country. So I have 3 requests: your own awareness, your own lifestyle, and also public health measures. If we do all this, क्या फायदा होगा? Generally, we say diabetes is increasing, blood pressure is increasing. Can we not say in 10 years, diabetes is decreasing, blood pressure is decreasing, less deaths in India? With these few words, I want you to be, everyone to be an ambassador, a champion of change in the country. Thank you for your kind attention.